James has worked as the lead organizer on Healthcare as a Human Right campaign since the Workers' Center launched that campaign in 2008 in order to reframe the healthcare debate and build a grassroots network capable of changing what was politically possible for state-based healthcare reform. Today, James is with us as part of the Healthcare Justice Tour across California and has already spoken to hundreds of fellow activists in LA, Orange County, San Diego, and at our own CARA convention to inspire us as we built our campaign for single payer in California and give us lessons we can learn from Vermont's efforts. Please, now you're not going to believe this. He's been doing this for 10 years. He started when he was 10. So please join me in welcoming James Hansen.
It is really wonderful to be here with you all today. Can everyone hear me okay?
Yes.
Okay. Good morning. This has been a very exciting and interesting and tour that has required lots of coffee. So as been stated, we've been doing this similar work out in Vermont for several years, and so we're really happy to be out here and to share our experiences and our lessons, and hopefully be able to give you things that are useful for your struggle here. We absolutely see our struggle in Vermont to be connected with struggles around the country, and especially in California. There's many things that are different about Vermont and California. We had when we set out to do our campaign, we definitely had a different task ahead of us. We have a much smaller state and many differences. But there was some, I've noticed being out here that there's some very similar things as well. Mainly that we have both had many chapters in this struggle for universal health care. This country should have had universal health care a long time ago.
Yeah.
And going back to 1948, for people that know about the Universal Declaration of Human Rights, coming out of World War II, healthcare, universal health care has been seen, and much of the world has been seen as a basic right, as a public good that everyone should have. The problem is in this country, we have now let a monster grow up, which is this for-profit industry that is trying to make money on our health in any way that they can. And we realize that it's not possible to be able to have universal health care on a national stage until it happens in the states first. So these struggles that we've had in Vermont and in California and states across the country to win it on a state level, we see as a prerequisite to being able to have it on a national level. The Workers' Center got started in 1998 as a workers' rights organization, as was stated. We do a lot of workplace rights stuff, helping people organize unions and addressing the lack of livable wages, and we raise the minimum wage and so on. But healthcare, from the very beginning, was a crisis that we recognized. And over the years, was a crisis that was getting worse and worse. Everywhere we turned, it was more and more of a struggle. We operate a workers' rights hotline where people call about workplace issues. And increasingly, that hotline was becoming a healthcare hotline, where people calling us in tears, asking us what are they supposed to do about their health care because their insurance was tied to their job and so on. And we work very closely with the labor movement, who, maybe over a decade ago, there was some leaders that would say, if people want health care, they should join the union. That had changed after many strikes, many difficult struggles, and the fact that people can't get a raise because every amount that they're able to get in increased salary comes out the other end in increased health care costs. And so the labor movement was moving towards realizing that they needed to be part of a movement to have health, high quality health care for everybody. So in the previous chapters, previous struggles, there had always been a universal health care single payer bill that had been introduced. And like California, at times they passed it and it was vetoed. And we were able to be part of those fights and also try to learn from them. So that when we launched our Healthcare is a Human Right campaign in 2008, we did so on this foundation of a lot of good work that had been done. But a couple of the things that we just wanted to share that were important to us as we sort of launched this part of the campaign. Number one, we thought it was important to reframe the healthcare crisis as a human rights crisis. It's not just, the fact that single payer saves money. It's the fact that right now in our communities, people are literally dying. People are living in fear and they're suffering because we have a healthcare system that is not based on keeping people healthy and giving people access to healthcare. It's really based about running a business to make money. And those stories in our communities all too often were left out of the healthcare debate. So we wanted to insert that everywhere we could. So every time we're talking about healthcare, we're really keeping in mind folks in our communities that are needing access to healthcare. And the fact that in the 21st century, in the wealthiest country in the history of the world, that it's unacceptable that people don't have access to the healthcare they need. So we wanted to reframe it as a human rights crisis. We also wanted to make sure that we got our communities organized. That it wasn't necessarily about the fault of legislators all the time. That it wasn't we'd seen a dynamic of people that had been involved in the struggle for many decades, just getting madder and madder, and rightfully so, because it is a crisis that needs to be addressed. But we saw really the challenge about getting bigger and bigger, about getting so many people in our community organized that we were able to change what's politically possible. And when people said they didn't think that it was, we could prove to them that the majority of constituents that they were hearing from were not only asking for change, they were demanding it. So we set out to get our communities organized. We also started using this human rights framework, which is more than just sort of a slogan for us. And it meant some principles that have been very useful in our struggle as we've gone into, especially as we've gone into passing legislation and getting into the nitty-gritty parts of running a healthcare system. Having these principles as guidelines as we go down this road has been really helpful throughout the struggle. In the beginning, the first year, one piece of it, we were just getting started. There have been many chapters. We decided to not focus on legislation in the first year. We wanted to get our communities organized, bring forth these stories, having organizing committees all over the state. And then in the following year, after having the biggest statewide rally that has ever happened on a weekday in our state capital, Healthcare is a Human Right, we felt then we had the capacity to move forward with legislation. So I know you all are wrestling with some of these strategic questions. We then pushed on a bill that had been introduced, that was a single-payer bill that had not been taken up by the Healthcare Committee but had been introduced. And we said we were demanding action on that. We will show a couple of quick videos about the struggle in Vermont that can definitely give you a picture of it much more than anything I can say, and then I'll update it from where we're at now.